Welcome to this episode of Lifestyle Matters. I'm Savina Nithyanandan, and today I'm joined by a guest speaker, Dr. Debby who is an obstetrician and gynecologist working both in Mount Waverly and Berwick. Welcome, Debby.
Hi, Savina. Thank you. Thanks for having me.
Thanks for joining us. It's the first time we've had a specialist on board, but I thought it would be nice to pick your brain about one of the common, women's health problem called Polycystic Ovary Syndrome. There's such a huge aspect of lifestyle component in managing Polycystic Ovary Syndrome. Hence, I thought this would be a great start to introduce a specialist in our show.
Yeah.
So, as a GP, I know that diagnosing Polycystic Ovary Syndrome can be quite murky for some people. We've got the Rotterdam criteria, which lists sort of, 2 out of 3 criteria that we look at, oligo or anovulation. So basically having irregular cycles or not ovulating, having signs of excessive androgen. So, being hairy or having sort of male pattern baldness, or, that can also be sort of shown in the form of having high testosterone levels in your blood test. And the third criteria that we look at is basically having X amount of cysts on your follicles on your ovaries. So more than 9 to 12, I believe, on
More
one
than
ovary.
20.
So 2 out of the 3 criteria we use to diagnose polycystic ovary syndrome. More than 20. Sorry.
Yeah.
Thank you. More than 20. And so I guess that's the criteria that we use. But what is it to you? What is polycystic ovary syndrome to you as a gynecologist, and how do you see it impact women?
So it's a big topic, and it's certainly, it's one of those topics that there's a lot of unknown and there's a lot of known, but it certainly impacts people in every aspect of our life. I think it's important to know that it's not really a disease, so there's no cure per se. It's more of a syndrome, so it's more of a condition where the management that we do is more tailored towards managing the symptoms rather than getting rid of this condition altogether, because it's not really a disease with cures in a way. And I agree that a lot of polycystic ovarian syndrome symptoms, a lot of it has got to do with lifestyle management that can help the symptoms to get better. So I think, with the Rotterdam criteria, even with them, it is still can be quite tricky to diagnose, because everybody presents in a different way. Not every woman with polycystic ovarian syndrome will have the same symptoms and the same issues that they complain of. Some will have, issues with their period. Some will have issues with difficulty losing weight. And some have issues with, the symptoms of increased testosterone, like acne. Or some only have incidental finding of polycystic ovaries. While I'm on that note, it's really important to stress that having an ultrasound scan which shows multifollicular ovaries, which can be, termed as polycystic ovaries, does not equal to having polycystic ovarian syndrome. It is one of the criteria that is needed.
Yeah, and it's especially in the early phases of menarche.
That's right, yeah. The first 8 years of menarche, it's normal to have multiple follicles, because your ovaries are like, whoa, it's just being stimulated. So it's all normal. So I think it is one of the criteria that we use, but definitely having an ultrasound scan showing that does not equal to having the syndrome altogether. So I suppose, being a gynecologist, I see a lot of women with polycystic ovarian syndrome who came with issues with their period. So having irregular period and having really heavy period. Also, women who is struggling to get pregnant. Those two are basically the kind of, patients that will come to me being a gynecologist. And certainly on further history, there's a lot of other issues.
Yeah, no, and I guess as a GP, what I've also seen is when I've picked up diabetes and then I backtrack and then you realize, right, there's also polycystic ovary syndrome underlying that was not picked up. And that happens to me as a GP. So, as you said, many ways to pick up polycystic ovary syndrome. And obviously for you, you see them more in the lines of fertility and irregular cycles. In terms of on your end, I guess, because we're sort of talking about the lifestyle approaches of polycystic ovary syndrome. So let's cut through the chase. We've diagnosed someone with polycystic ovary syndrome. Let's put medications aside. Like, what would your first line approach be in, talking to someone with polycystic ovary syndrome and, any advice you might have around that?
I think it all comes down to polycystic ovarian syndrome. Like, where does it come from? And it's all, obviously, we don't actually know the pathophysiology per se as to what brings on, polycystic ovarian syndrome. And certainly there's no single gene, or it's not genetics per se either, but we certainly see that it is something that can run in the family. I don't know, again, whether that is something that is, genetics, or is that a lifestyle, but it's definitely something that's quite complex, that can also potentially because of the lifestyle that we live. Anyway, coming back to that, right? A lot of what we know about polycystic ovarian syndrome is all got to do with insulin resistance, and because the body in someone who has polycystic ovarian syndrome is resistant to insulin, so the body is trying to produce more insulin, and that also produces more testosterone, which is the secondary male hormones that we women normally have, but not as much as men. So in women with PCOS, because of that, there's also a higher risk of testosterone causing all the symptoms. And a lot of, knowing where it starts, that's when lifestyle management is important to reduce the insulin resistance. So usually the first thing that I talk to patients about is healthy lifestyle, which basically exercise and diet. We know that not all women with polycystic ovarian syndrome is overweight, but we know that, the majority of women who have polycystic ovarian syndrome has issues with weight, be it overweight or difficulty losing weight. But we know that losing 5 to 10% of body weight in this group of women who are overweight will help to get rid of the symptoms. Being, when I say the symptoms, most of it being with the anovulation, and obviously then leads to fertility.
Yeah, I was just going to pipe in there about the weight gain issue. What I also understand is women with polycystic ovary syndrome have actually a higher rate of weight gain than those without polycystic ovary syndrome, about 1 or 2 kilos per year, which is, actually a real struggle, so it is actually a real problem for them, and because of the insulin resistance, which you've just described. And I think the other thing is, I read somewhere where they said, I guess in Australia, the indigenous women, those who are overweight, like who've got a BMI of more than 30, about close to 30% of them actually meet the PCOS criteria. They actually have polycystic ovary syndrome, and that's quite a large number.
Yeah. I think.
Yeah. So, it just comes down to what you talk about, insulin resistance, I guess.
Yeah. In Australia, I think the incidence rate of PCOS is about 8 to 13% in general population. And we certainly know that there are certain ethnic groups, and indigenous population is one of them, that is definitely higher risk of developing polycystic ovarian syndrome, or, have more prevalence of PCOS. And again, is that partly because of genetics? Is that partly of lifestyle. So it's a very complex discussion here that we can have, but I suppose no one really know what caused it per se.
Do you happen to have a spiel about the diet and exercise for your patients?
Yeah. So I think in terms of diet, right, I think, well, before that, normally depends on how motivated and how severe the situation is too. I think polycystic ovarian syndrome, to begin with, is not something that can be managed by one or two people. I think this is a condition where it affects so many facets of your life that it should be managed by different teams, different specialties, and being led by a GP who, deals with the holistic approach of the patient. So I think I normally talk to patient about, maybe seeing a dietitian, as well as exercise physiologist to help them with managing the weight loss in a healthy way, because diet alone is not manageable, or maybe not sustainable, as well as exercise alone without the good diet may not help with the weight loss either.
That's right. It's that multidisciplinary approach, isn't it?
Yeah, and it's about teaching them about what is the safest but most manageable way that can sustain you. And sometimes it's not about short-term change and hoping that this will actually be a long-term change. So I normally talk about referring them to see a dietitian, as well as seeing an exercise physiologist or joining the gym. But generally speaking, I normally tell patients to have about 30 minutes of moderate to vigorous exercise a day. I think the guidelines is about 150 minutes a week of vigorous exercise in a week.
Yeah.
So that's what I normally tell patients. And
so I think the recommendation is about 150 minutes of exercise, and 90 minutes of it at least being moderate to high intensity. But there is no actual evidence to say, you need to only do strength exercise or you only need to do cardio. They would want an aerobic sort of moderate to high intensity exercise, but obviously an incorporation of strength base and aerobic weight base are basically going to be quite helpful to do both.
Yeah.
Carry on.
Yeah. No, so that's the thing. I think it's not something easy to just go into. And it's also something that, I normally tell patients that, look, if you haven't been leading an active lifestyle, like, I'm not expecting the change to be drastic. So even if it's just about making an effort to have a 30 minutes casual walk to begin with every night after dinner, that will just help with, I think, getting out there, increasing your heart rate, as well as that can help to reduce the insulin resistance as well.
Yeah, so that's the non-incidental exercises.
Yes, actually, yes, that's the term.
Yeah. So even just like, when you go grocery shopping, park your car a bit further away and taking that walk to the shops to go get your groceries instead of parking right in front of the shopping center. So little bits like that, starting small and building from that. Definitely helpful.
Every little thing counts. And I think, again, in terms of diet, there's no evidence as to what diet is good to reduce the symptoms of polycystic ovarian syndrome. There's no evidence that any is good. And really, I think it's not about a diet per se. It's more about the lifestyle, the changing the habit of eating healthy and counting calories rather than, keto diet or a certain kind of opti-fast diet, because that's just not sustainable in the long term.
Yeah, I think that's the downfall of diets mostly.
Yeah.
So I guess it comes down to, eating a lot of your 5 serves of veggies and fruits. And, people always say carbs are bad, but I think we've talked about it previously in the previous episodes where carbs are actually not the enemy. It's more the
Yeah.
processed white carbs are potentially the enemy, not so much your complex carbs, because in fact, complex carbs are lower GI. So they actually lower your sugar and insulin levels compared to high GI foods. And they actually keep you fuller for longer. So, don't go on a fully low carb diet and not eat any carbs, because that's also not going to be helpful either. So it's about, as you said, not sticking to one diet, but having all your food groups in the right moderation and quantity. And that's where I think a dietitian, or if you have a GP who practices lifestyle medicine, speaking to them, that can also help. If you don't feel like to see a dietitian, but it comes down to eating holistic properly, having all your food groups.
Yeah,
Basically.
eating smart, isn't it?
It is. It is. And also focusing on all those MUFAs and PUFAs, your monounsaturated fats and polyunsaturated fats as your fat sources, instead of eating, animal fat for fat, but eating more like your olive oil, your nuts, the whole Mediterranean diet side of things. Focusing on that as your fat sources also be helpful, and eating less processed and packaged foods, because you can think about all the added sugars and salts that they have in those tins and packages too, which wouldn't help insulin resistance.
Yeah. And I think Mediterranean diet is definitely the thing that I normally tell patients to look into, because that has also been shown to help with fertility, and a lot of these patients are also looking towards fertility. So I think there's something about Mediterranean diet that I suppose is good.
Yeah. But just for going back to when you were talking about exercise, the other point I wanted to make with that is that, just because you exercise, and if you don't notice any weight loss, it doesn't necessarily mean it's not actually assisting with insulin resistance. It actually is. And, it can help to potentially reduce your, it can potentially reduce insulin resistance. It can help to, induce your ovulation and fertility. So don't feel disheartened if there's no weight loss. I think exercise is still going to be good, because it comes down to what exercise you're doing. If you're doing strength-based, you're building muscles, you might not get that weight loss. Although evidence shows that when you do, that's why the whole facet about having that aerobic exercise is important, so that you are inducing weight loss. But my take on that is it comes down to what kind of exercise you're doing, and not to feel too disheartened if that weight loss is not there. Keep exercising, and focus on your diet. Like it's what you pointed out too. You've got to do both diet and exercise. One won't work without the other. What are your thoughts about mental health in the setting of polycystic ovary syndrome, Debbie? In general practice, I see a huge implication of it. Can you give me your own opinion on that?
Yes, certainly. I think mental health is something that's more prevalent in women with polycystic ovarian syndrome. And I think it's one of those vicious cycles, isn't it? Like you could start having anxiety and depression, and it's just exacerbated by all the issues that comes with polycystic ovarian syndrome. So you could find it so stressful with, having abnormal hair distribution, acne, difficulty losing hair, the stress of getting pregnant. That can definitely exacerbate the anxiety and depression. It's such a vicious cycle, and certainly something that we see very commonly in patients with polycystic ovarian.
And then you start comfort eating, and then you put on more weight, and then you have body image issues, self-esteem issues. It all comes all hand in hand. So I think it's also important for us to be aware of it. Like, it's not diet and exercise. It's also mental health, as you aptly put it at the start. It's a multidisciplinary approach. It's not just one person that manages polycystic ovary syndrome. It's a team effort.
For sure. Yeah.
Yeah. And I guess the only thing I'd like to highlight before we wrap this up is that, in the previous episodes, we spoke to Amanda Smythe, who's a dietitian, who was talking about mood food, about eating for better mental health. And that's something that our listeners could also listen to potentially sort of eat better, to feed their brain to, make them feel better, as opposed to reaching for the carbs and the chocolates, which we know, yes, instant gratification, but we know what happens when it starts slumping down. But yeah, I guess that would be my take on it. The whole the three big parts of polycystic ovary syndrome. Do you have any final words to add, Debbie, from your perspective?
I think the only thing I want to add is that it's not just the issues that we talked about, which is like fertility, difficulty losing or gaining weight. Losing weight and the abnormal bleeding. I think it's about the long-term health impact as well, about how, having polycystic ovarian syndrome puts someone at risk of type 2 diabetes as well as metabolic syndrome. That definitely, it's something that needs a long-term management, not just something that we deal with acutely.
Yeah, and the metabolic syndrome comes with the high cholesterol and increased waist ratio and things like that. So yeah, definitely. So it's a chronic disease. It needs regular follow-up. And that's basically the bottom line. And I think that if any of the best advice that you just pick on what you said just now is, if someone with polycystic ovary is trying to fall pregnant, the first thing to do is try to lose the weight. That 5% weight loss can have a huge impact on fertility and ovulation and things. All right. Thanks so much for joining us today, Dr. Debby Utama. I look forward to chatting with you at another time.
Thank you. Thanks for having me. Looking forward to it.
Thanks for watching this episode of Lifestyle Matters. Till next time.